Hello, everyone. This is Mark Caskelson, the president of Compliancy Group. Thank you so much for joining us for our free educational webinar series. Today, we are going to be talking about some of the benefits of being HIPAA compliant. It's not just about the law that you're satisfying. There's a ton of really great other benefits that come out of it. If you are not familiar with our webinars, both upcoming and past webinars are on our website. We have a ton of free resources that you're welcome to hit our website up for: white papers, articles, checklists. For today, I'll be doing my best to answer questions. If we do run out of time, please, any questions that you post to us, me or somebody on my staff will be getting back to you for. So, what are the benefits of HIPAA compliant? It's more than just passing your audit. HIPAA as a law was designed to help, you look at your business to understand where your risks are, and then ultimately address those risks to protect your business, protect your patients, and ultimately improve the quality of service you're giving. So because of that, there's a lot that can happen. For those of you who are not familiar with Compliancy Group, we are the industry leader. Our standard is our seal of compliance is a standard that is in healthcare. Over 40 plus medical associations endorse us or recommend us. We are very heavy in the compliance and the cybersecurity arenas. We focus specifically on making sure that we simplify compliance so you can confidently focus on your business. And we are very proud, and as we go through the information today, you can be confident that even though we are involved in 2 or 3 federal or state audits on any given month, in the 14 years we've been doing this, we have never had a client ever fail an OCR or CMS audit. Okay, so now that hopefully gives you comfort that what I'm going to talk about today, you can trust. So let's talk about the benefits of HIPAA compliance. Now, it's a law, so you're going to do that. But let's talk about by doing the audits, okay? And I'll explain later about what's required under HIPAA compliance. Ultimately, you're going to increase your profitability because you're going to be looking at all your areas of weakness and fixing them. 2, one of the other byproducts that we see from that is that your employee satisfaction goes up because now you have very clear policies and procedures. So the ambiguity of what am I supposed to do goes away. Okay, because of that, you end up increasing your patient and client loyalty and ultimately your retention. Now, it is a law. So the basis of the law is about you looking at your risks. So by being HIPAA compliant, you're also reducing your risk and liability. Often that can result in lower insurance rates, better rates on loans, etc. Now, the given, it's going to help you protect your patients or your clients and ultimately your reputation, because if you do have a meaningful breach, I'll talk about some of the things about the wall of shame in public record. It is going to negatively affect you, and we want to help you avoid that. Now, so what makes clients and patients loyal? If you look at various different studies, the 5 key predictors of patient and client loyalty revolve around just general overall satisfaction, what other people are saying about you, so what they're seeing in social media and from their peers, the satisfaction with how you resolved a problem, and this is going to go back into compliance and policies and procedures, etc. Your staff following through with what they said they will do. Same thing. This comes back very much under compliance, which is there's rules and there's disciplinary guidelines of what you need to do, and if you don't do it, there are repercussions. Lastly, how you treat your patients or your clients with dignity and respect have a great value. All right, and when I start getting into more of the details of compliance, you'll understand and see how those things directly relate. So now, if you're thinking, well, I'm not really going to worry about compliance, no one's really worrying about it. Well, if you ask your clients and or patients how they feel about compliance, what you'll find is 68% of them are not confident that you are taking good care of their records at all. And to make matters worse, 53% of the people that have had a massive breach or their information stolen believe that it was actually caused by their doctor or their medical professionals. Okay. Now, we talk about protecting your reputation. If you are involved with any sort of breach or incident, the law requires that you must report it. When you report it, understand then the OCR wall of shame, or the Office of Civil Rights wall of shame, is public record. So there was going to be a public record of the incident, who was involved, how many people were affected, and the basic location of where the breach information occurred. So you cannot hide, folks. If you have something go wrong, even if you were not wrong, even if it was a legitimate issue, it is public record, and people are going to be looking at it, and depending on who it is, they will decide whether or not they're going to continue to do business with you or not. So, trust in general is hard to, you can spend a lifetime earning it, but you can lose it in seconds. Okay. So a breach or an incident can often take, years of trust that you built. So if you look at the different things of where trust come from, okay, now, unfortunately, whether you like it or not, 20% of your clients and patients you're losing every year. And I can say, as somebody who often I'm at social events and they ask what I do, and I say I am in HIPAA compliance, they start telling me all the horror stories of what happened at their offices and why they didn't go back. Okay, now that gets exacerbated by how many of your clients or patients are referring other people. And most people, although we're going to talk about social media, still rely on what is other people's recommendations of what they would do. Now, the good news is if your patients like you, 83% of them would gladly recommend you to somebody else. Okay. Now, but what you do have to be aware of is even if they like you, okay, if something is going wrong, they want to feel comfortable that they can trust you. Okay, so 82% of them, they will forgive you if something goes wrong, but only if you show what is your, a series of good faith efforts. And this is where compliance will come back into play. Okay, so, how do you grow your practice with HIPAA? 61% of your patients will check online reviews before they will select a doctor. Okay, so by being HIPAA compliant, and for example, in our case, we'll talk about a seal of compliance. The statistics are that if you have an indicia that you are compliant, there is a 17% higher likelihood that they will do business with you, whether it's a client or a patient, because of that indicia. Okay, now there's other statistics that even after they like you, they will still go online and either look at the other reviews to see if other people had a good or bad experience. So even if you did okay, understand you'll lose them based on the experience they have, often from a social media perspective, or the interaction they have with their other friends or clients. Okay, now we talk about a seal of compliance. Compliancy Group is very proud of our seal. It is endorsed by over half of the medical associations in the United States, and it has but there are lots of other types of seals. So you see Better Business Bureau, you see things like Google Trust, PayPal, Authorize.net, which is payment processing. Okay, what it does is it's really verifying and validating that you're a good person to do business with. Okay, and they'll use it as a differentiator, okay, when they're deciding what business to work on. So I can say in regards to our clients, we've had folks like Phone.com receive over 700 new partner relationships. Organizations like VMrax, which is a hosting service, specializes in just HIPAA compliant hosting. They've received over $1 million in additional revenue because of that indicia. And then lastly, some of the statistics I spoke about earlier, that bearing a seal on your website on average will increase your conversion by what's called, conversion is how many people come to your website and then choose to do business with you, by 17%. So there's an opportunity here. Now, when we talked about those 5 things that drove patient loyalty, the reason why that's so important is if you understand the way HIPAA is written, okay, the law ultimately is enforced not by fancy technology, but by something that's called the 7 fundamental elements of an effective compliance program. This is the actual federal guidance. It's what auditors use when they come audit you. So I'm going to use a backdrop of a Starbucks coffee experience and to illustrate both patient and client loyalty. Okay, so when you walk into Starbucks, the people you're going to be looking at have been definitely, there were policies and procedures. There was a manager who's watching them. They've made sure that they were very carefully trained so that cup of coffee is timed. There's certain temperature settings, etc. What you'll also find is there's very specific lines of communication. One person writes your name on the cup. They speak that to the next person, the next barista, who then makes your cup of coffee. Now, throughout the entire process, there's very effective monitoring and auditing. They're watching the temperature, how long things have been sitting, how long the line is. And ultimately, for people who don't do it well, there's enforcement guidelines. There's disciplinary guidelines that say if you don't do it well, you'll be suspended or lose your job. And then ultimately, if something isn't working, they're very quick to report that back to their management. Now, this is how Starbucks justifies spending, charging you so much more for a cup of coffee, an extra $5 for something you can make at home for 50 cents. Now, why I equate that to patient loyalty is if you think of the things that were really important on patient loyalty, it was, are your people trained to understand how they're supposed to handle problems? Is it clear that if they don't follow those rules and don't respond to your patient or client in the proposed way, that they will be fined or penalized, okay, or suspended? So all these things come together, and that whether, strong brands in general all function this way. They all have very, very specific, what we would call an effective compliance or management program. They're keeping track of making sure their people understand what is required, what is expected. They have effective, and effective is a very important term here, because what is effective for one organization may not be effective for another. Okay, and this is one of the reasons why HIPAA as a law is a little more complicated to enforce. Okay, now, from a basics perspective, and this is, we're going to get a little bit into the HIPAA law here, is understand that there are really three parts to the rule. And one of the big misunderstandings that happens in today's world is privacy, everyone seems to get a general understanding on. Where most people get a little confused about is what's called the security rule. Okay, many people are attesting from macro MIPS or meaningful use, so therefore they will ask for what is a security risk assessment. Unfortunately, if you're just doing a security risk assessment, you're only addressing 1/3 of one of the rules. Okay, you must be doing your physical, administrative, and privacy audits as well. And then under the breach notification rule, which is really omnibus, you need to make sure that the organization, that you have business associate agreements in place, and that if there is a breach, if it is meaningful, there's more than 500 people affected, it must be reported within 60 days. Non-meaningful breaches, whenever necessary. Okay, I'm sorry, at the end of the year. Now, why we think, misunderstandings of this often revolves around security. Okay, and these are the misunderstandings that will affect what is the positive brand experience you have. Is if you need to be making sure that you do everything correctly. Doing everything correctly will give you that better brand experience, your increased profitability, your patient loyalty. So what that looks like is you need to be doing 6 audits. Okay, there's 6 different audits that are due every year. So for example, if you're not familiar with a high-tech subtitle Part D audit, understand there was one that was required every year that you've been in existence as under healthcare law. So if you've never heard of it, you're already breaking the law. Now, you have to document your gaps and your remediation plans. To go back to the benefits of HIPAA, by understanding what your weaknesses are and then creating a remediation plan to fix them, you are fixing your business. You are making it stronger. You're giving your employees greater strengths. You are most likely also going to affect what is profitability, because you're not going to have those weaknesses that we're bleeding away your profits. Now, how you keep people organized and following the rules is policies, procedures, and training, also mandated under HIPAA law. The next thing that comes up is, under HIPAA law, each one of your employees every year has to attest that they understand and they are going to follow your policies and procedures. Same thing, by having that in place, you're making sure your staff understands what is required of them, what is expected of them, so therefore it's much easier for them to serve your people better and ultimately be happier. Now, business associate management. About 30% of the breaches that exist in the United States or happen in the United States were caused by your vendor. So by having business associate management in place, required under the law, you're going to be making sure your vendors have everything in place to protect the information you're sharing. So that's good business. And then 2, you're going to have a very clear documentation of what the rules are. So if they don't follow the rules, you ultimately have the ability to move on. Okay, you're not liable for what they did. You're only liable for what you do. Now, incident management, also required under the law. Think of a patient that something, or a client, something goes wrong. They report it. You want your staff to have a formal process to investigate it and then ultimately resolve it. And this is what is considered an effective compliance program. Okay. Now, so in the end, HIPAA is good for business. It is legally required. Notice I didn't get into the whole fines, and the average fine $1.5 million. Most businesses that have, that are fined, 60% of them will go out of business. HIPAA is also a marketing opportunity, a seal of compliance, and you being able to brag on, in the market, in social media and in your marketing that you are HIPAA compliant differentiates you. Because remember, kind of what you saw with the 53%, most people believe the mistake that was made and their identity was threatened by you. So saying that you are doing everything to protect that is very important. Now, lastly, this is how you differentiate yourself. Okay, the law is the law, but those of you that take it seriously, okay, you will be more profitable. Your employees, and your clients and and patients will have a better brand experience. You will ultimately be secure, so that the risks that most people are getting, let's say with ransomware and other type of cybersecurity threats, are not going to happen to you. So you're not going to go now. By the way, they can happen, but because you are HIPAA compliant, you're going to have done everything you can to prevent extensive damage. You would have had encryption and backup. So the data that was stolen would not be stolen. You wouldn't have to repeat it, report it, because they couldn't use it. And two, because you were properly backed up, all required under HIPAA law, you would not have any service issues, because you'd have your database right back up so you can serve your patients or clients the next morning. Ultimately, you can use this in your general marketing, and absolutely something you want to use in your online and social media strategies. So by the way, there are a series of webinars we do on HIPAA compliant marketing and social media. So do jump in on one of those so we can teach you how to use the stuff we're talking about, the benefits, but ultimately I think it's very important. So let me answer a couple of questions. So would becoming HIPAA compliant be beneficial to a doctor looking to sell? This is a great question. Okay, we deal with a lot of the private equity firms, and often they will actually come looking for our clients that have our seal, because what it means is you've already addressed all of your risks. Okay, you've identified all of your weaknesses, and you've either addressed them completely or you have a plan to address them. So that makes you much more appealing to a private equity firm or for another doctor who's looking to buy your practice, because you're basically saying it's ready to be sold. It's clean, it's ready to go. Okay, by the way, folks, if you're not familiar with, you post your questions on the right-hand side. Basically, no one will see. They won't know your name or anything, so you're posting them directly to me. I'll do my best to answer them. Okay, so next question. What are the best ways to show patients that you are HIPAA compliant? Well, obviously, we would love you to do business with Compliancy Group and bear our seal of compliance. Bearing our seal is a third-party verification and validation that we've done everything required under the law, and you have all the documentation to prove it. But and in that case, you can put it on your website, you can put it on your marketing literature, you can put it in your window. Now, if you don't have that, you can put other illustrations or statements about your compliance. The problem is, it's kind of like, it's kind of hard for you to profess your own, your own compliance, because ultimately it's easy for most people will be skeptical and be afraid that you might be lying. Okay, so having a third party is your best bet. Okay, now, how much time does it take to become compliant? Well, compliance is an ongoing thing. Okay, so I can tell you in regards to the way we work, we require a new client to spend about 20 hours to become HIPAA compliant. Maybe 5 to 8 half-hour meetings with somebody on our team to truly have an effective compliance program implemented into your organization. After that, it takes a couple of hours a year to maintain. So it really does not have to be time consuming. Now, that is in a model where Compliancy Group, which is our motto, is to simplify compliance so you can confidently focus on your business. If you were to do it yourself, and by the way, the law was designed so you could do it yourself. The challenge for most people is it's about 600-700 pages of law, and how to understand how to apply that to your practice. And I will say hhs.gov or ocr.gov, which are the websites, have gotten much better than they were in the past. So if you're interested in doing it yourself, do go take a look at those websites. They're free. They're government sponsored. And I will say, and even though I'm the president of a compliance company, you can do this yourself. It was designed for you to do yourself. The real challenge that we see for most organizations, and this is why so many people outsource so many of their things, is, if you were, for example, a doctor, you spent many, many years studying your profession, you make money when you're seeing patients, not when you're dealing with paperwork. Okay, so our role is to, shorten the time as much as possible. Okay, good. Lots of good questions coming in. Please keep them coming. Is the seal something that you can use to advertise? Yes. Okay, so if you do have a seal of compliance from Compliancy Group, we give it to you so that you can put it in your email signatures, an actual what's called a snippet of code, so you can put it on your website, that if someone clicks on it, it actually comes back to us and we verify and validate, yes, you've done everything required under the law, and you can prove it. We give you material to put on your letterhead, as well as press releases most of our partners put out when they have achieved HIPAA compliance. So yes, you should absolutely want to leverage this. You want to use this to help differentiate your firm. When we talked about the benefits, marketing and social media is a big part of that. Okay. The next question. As an IT provider to medical facilities, do I have any further liabilities? Okay. So for those of you who are, okay, there's a mixed group of folks on the call today, covered entities, which are doctors' offices, and business associates that are vendors that serve you. Okay. So about 60% of the market, believe it or not, is vendors, not doctors. But yes, as an AT provider to medical facilities, you don't have additional liabilities, you have the same liability, okay? i.e. the law, HIPAA is the same law to both a covered entity and a business associate, okay? One of the things that I can recommend that will limit your liabilities and reduce your risk is by being HIPAA compliant and truly having all the things in place. You have a better business and you will be able to prove that you've done everything you could to lower the chances or reduce the risk of a problem. But two, you need to sign business associate agreements. Now this goes both ways here, folks. Whether you are a covered entity or a business associate, doctor or the vendor, business associate agreements are good protection. The reason being, a good business associate agreement simply states that you both understand you fall under the federal law of HIPAA law, okay? And that you are both responsible for yourselves, i.e. you cannot find me responsible for your HIPAA compliance, nor can I find you responsible for mine. Okay, so it draws a good line in the sand for the federal auditors that depending on where the mistake was made, then they know who to pursue in regards to the investigation and the fine. Okay, that's the best way to reduce your liabilities. All right, so looking through the questions, yes, this will be available on our website recorded. You can download it or watch it or introduce your friends to it. One more question. Okay, what happens if my vendor won't sign a business associate agreement? Our recommendation is find another vendor. Now, whether you are or not working with Compliancy Group, we have over 80,000 users on our network where I'm sure we can find you a vendor who actually is HIPAA compliant and will gladly sign a BA agreement. Okay, folks, I'm not seeing any more questions, but before I let y'all go, one thing I want to point out on the screen, we offer a free security and compliance checklist. This is not something you're filling out and giving back to us. It's an actual thing that you can download, about 10 questions. You can go through it on your own. And the way I would say is it's a great way for you to take a quick look at yourself and say, for example, if you can answer all the questions confidently and you understand them, you're in great shape. If you have trouble with the questions or there are parts of it that don't make sense to you, then chances are you're probably not HIPAA compliant. So what I would recommend is feel free to get a quote from us. We are very, very, very cost effective. Please don't be shy. If please download the checklist and feel comfortable asking us questions about how. By the way, we won't try to sell you. If you just have a question, it's our answer to answer it. Our pleasure to answer it. But we do hope that you'll find out just how simple we can make compliance and how cost effective it can be. All right, everybody, thank you so much for joining us on this educational webinar today. Hopefully you'll join us for many more. And please don't think of HIPAA as a law that you have to satisfy and as a negative thing. Think of it as all the benefits that you get by being HIPAA compliant in serving your patients and or clients better. Once again, Mark Haskelson here from Compliancy Group. I really appreciate your time today. Thank you, and we look forward to you attending our next webinar. Have a great day.